Well, I'm glad I tried because it says the host has disabled screen sharing. So whoever the host is will have to give it to me here.
I think Leanne is a host. I thought she co-hosted with you.
Well, it's telling me I can't, so.
I did add you as a co-host, but I will do it again.
Okay. Thanks. I'm glad we tested it a couple minutes early. Oh, it says I'm the co-host now, so let's see. Yep, it'll work. That look okay from your end, Leanne?
It does, yep.
Okay. All right. Well, we'll give folks a few more minutes to come in here. I think maybe we'll wait just another half minute or so, and then we'll get started. I know we're not going to be a huge group, but we'll give people a chance to pop in here. Jackie, Chris Owens was going to be here, right?
Yes, he had a meeting that ended at noon, so he should be joining any time now.
Okay. Well, we probably can get started, and then because we've got some stuff to cover before his section.
Yes.
I would like to welcome everyone. This is really a first for us in terms of doing new faculty orientation, and certainly doing it by Zoom. So we're going to cover some of the information that we covered in our opening assembly, but I also wanted this to be a less formal and interactive kind of a meeting today. And so if you have questions as we go along, we would love to hear from you. Because we're a small group, I think that we'll do introductions. And I'm just going to call out your name real quick. And if you just give a brief introduction, who you are and which department you're working for, and maybe just a little about yourself, that would be great. My upper left is Tony. You can go first.
Hi, everybody. My name is Tony Christofferson. I am the new Accelerated Program Coordinator and Clinical Assistant Professor here on the Meridian campus. I'm in the School of Nursing. And a little bit about myself, we'll just keep it light. I have 3 children, 2 boys and a girl, and 2 little puppies, Octavian and Viper. But I am a registered nurse, and I've been working in the field for over 30 years. And my area of specialty is pediatrics, and my research has been in adolescent health and looking at the outcomes of different staffing models. And I am very excited to be here at Idaho State. So thank you.
Great. Thanks, Tony. Leanne, quick introduction. We're going to talk about you as we go through the presentation, but please.
Yeah, hi, I'm Leanne Waldron. I'm the Marketing and Communications Director for the Kasiska Division of Health Sciences. I am at the Pocatello campus and have been with ISU just about 2.5 years. And I'm moderating the event today. So if you have a question, you'll notice I typed in the chat box. You can send a question via chat. And if you want to do that anonymously, just make sure to select my name and you'll see that it says private. And then it will go just to me and we can ask those questions anonymously.
Great, thanks. Hi, Brian.
Hey there. Hey, everyone. So glad to be here today. My name is Brian Austin. I'm obviously just getting my feet wet and getting started here at ISU. I am within the Department of Counseling, and I was hired to start and develop the new clinical rehabilitation counseling program. And so I'm the program coordinator also of the program. I've been working in the field. This will be the start of my 25th year and focusing on disability and rehabilitation. And I come over to ISU from another successful program from the University of Idaho. So I'm excited to be a part of the counseling program and just see so many opportunities, but also within the Division of Health in terms of future potential for interdisciplinary collaboration and research. So with that said, you know, I have a family here. I'm based in Meridian. I love Boise. I've learned over the years, over the last 8 years, quite a bit about Idaho. And what's kind of interesting too is I have family who grew up in the Treasure Valley and who went to U of I, and also my dad was a smoke jumper in the Payette National Forest. So he knew I would love Boise just because of the outdoors nature. I love to hang out and with family, friends, but spend time outdoors is really where I feel most at home. So glad to be here.
Thanks, Brian. Chris Sanford.
Yeah, hello, everybody. I've been here at ISU for about 11 years. And I'm currently serving as the chair for communication sciences and disorders, and also as the interim associate dean for the School of Rehabilitation and Communication Sciences. So I'm an audiology faculty member. That's my discipline. And I love ISU, grateful to be here, grateful for the opportunities, and just like to welcome all the new people. You made a good choice, and so we're super happy to have you here.
Thanks, Chris. Hi, Karen, you're next.
Hi, welcome everyone to Idaho State University. I'm Karen Neal. I'm the Associate Dean and Director in the School of Nursing. I've been here 35 years and I love the outdoors, and I know You'll love Idaho and Pocatello in particular and ISU. So welcome to our Bengal family.
Thanks, Karen. Hi, Barbara.
Hi. In contrast to Chris, I've been here 11 weeks. I'm the new program director for occupational therapy. And I work remotely. I live in the Washington, D.C. metro area. I'm not sure what else to say. I've been an occupational therapist for a long time. I've got 6 kids who are all grown, thank goodness. And I guess that's it. I'm a past president of the American Occupational Therapy Association. I did a Robert Wood Johnson Health Policy Fellowship and I worked in the Senate when things were a little less crazy than they are now. That's about it.
Thanks, Barbara. Nishan.
Hi, everyone. My name is Nishan Borden. I'm a new faculty member, assistant professor in the counseling department. Is health counseling, so I teach in that track. Just got to Idaho from Florida, so I'm excited to explore Idaho, explore the West, and to be at ISU. So it's nice to meet everyone.
Great, thanks. Catherine.
Hi, my name is Katie Canavan. I am a clinical assistant professor in the occupational therapy program, and I am also the fieldwork coordinator for our program.
Thanks. Lori.
Hi, everybody. I'm Lori Holdeen. Just came on board as new faculty and program director for Homeland Security and Emergency Management, which is part of the Emergency Services Department. So I'm really happy to be here. I moved over from Oregon. I'm originally from Seattle, Washington. I've lived in DC and I've lived in Phoenix, Arizona. So I'm well traveled and lived in a few different areas. I love Idaho so far. It's been great. And ISU rescued me when my university closed its doors and our program, our Homeland Security program, was kind of abandoned with that unfortunate turn of events. So I'm super happy to be here and to be working with Mike McKiddish. So nice to meet everyone.
Thanks, Lori. We were happy to rescue you. Melanie Wright.
Hi, everybody. I'm Melanie Wright. I am a research associate professor. I've actually been in Idaho already for getting close to 9 years. I came in 2011 from Duke University. I was in anesthesiology. I'm an industrial engineer and I have psychology training, but my background is human factors engineer, and I really sort of consider I've been lately calling myself a healthcare technology research scientist. It seems to be like the easiest way to describe what it is I do. I'm very much a multidisciplinary across kind of different roles in healthcare, but I'm in the College of Pharmacy here, which is great. I feel a real kinship with pharmacists. I think they think a little bit like engineers on the healthcare side. So it's been a really kind of good fit. Started in March. I kind of pressured Rex a little bit on the timing because we had a grant coming in, which worked out well. So we were able to get in and get that into ISU and work just, but my role is primarily research. So working with other people, mostly in pharmacy at this point, but interested in collaborating in things like emergency services. I guess I've done work on like patients who are violent and things like that, which I think is good fit. So yeah, so I'm really looking forward to continuing to work at ISU and do more of the good stuff we're doing.
Thanks, Melanie. Mike McKiddish, welcome.
Welcome, everybody. I'm Mike McKiddish. I am the chair for the Emergency Services Department, and we were glad to rescue Lori too. We can pass one of my hats over to her. I am also a program coordinator for our Fire Service Administration program and program coordinator for our paramedic program. So we have three major programs within the Emergency Services Department. And so I'm also a vice chair for the American Red Cross. Been at ISU for about 14 years and glad to meet everybody.
Thanks, Mike. Chris Owens, hi.
Hey, hello everyone. Yeah, my name is Chris Owens and I'm the Associate Vice President for Health Sciences. I work with Rex in the main division office, and I'm also a faculty member in the College of Pharmacy. Welcome.
Thanks, Chris. Erin Berry.
Yes, hi everyone. So my name is Erin Berry. I am brand new this year. I'm a clinical assistant professor with the College of Pharmacy. I am a co-funded faculty member, so that means I am part-time with the College of Pharmacy and then the other part-time with Eastern Idaho Regional Medical Center in Idaho Falls, where I precept students. So,
welcome, Erin. People have moved around on my screen, and I'm hoping I haven't left anybody out. Irene Van Worden.
I'm just about to say you've missed me. So hi everyone, I'm Irene. I'm in the Department of Community and Public Health. I'm based in Pocatello. And one of my things is that I'm a statistician. So you're going to be having the Mountain West CDRIN grants coming out, announcement probably in a few weeks or so. So if you've got need any help with statistics with that, let me know. And for my own research interests, I look a lot at food insecurity, body size, a little bit at chemical exposures, and I'm also looking at social networks and friendships. So are there friendships that are going to be detrimental or beneficial to our health and our BMI and things like that?
Great, thanks, Irene. I'm going to ask Connie and Jackie to introduce themselves because they're important parts of the Division of Health Sciences. So Connie Tillotson, how about a quick introduction? I know you're trying to remain behind the scenes.
I know, you know me, I hide my face. I'm Connie Tillotson. I'm a Rex Forces Management Assistant, and I've been at the university for so many years, I cannot even count it anymore, but welcome to KDHS.
Thanks, Connie. And Jackie? Did Jackie just drop off when I asked her to introduce herself?
She's muted.
Oh, here we go. Hi, everybody.
Oh, there she is.
Here I am. I'm Jackie Furio, and tomorrow will be my 8-year work anniversary for ISU. So I really enjoyed working at ISU, and I hope all of you do too. I've had the pleasure of emailing with most of you when you first started, and so it's great to put faces with names. And I work in the main KDHS office, so it's nice to see everybody.
Thanks, Jackie. So for those of you that don't really know me, I should do a little introduction too. I'm Rex Force, and I'm the Vice President for Health Sciences. I've been at ISU for going on 28 years. And my academic home was the Department of Family Medicine. I'm an academic pharmacist, so I also taught in the College of Pharmacy, but my main role was doing research and teaching our family medicine residents in that program, as well as starting the pharmacy pharmacotherapy residency program in family medicine. Few years ago, I was appointed as the Associate Dean for Research in the division, and about, what would it be, a little over 4 years ago, began this role as Vice President for Health Sciences. And we'll talk a little bit about, in just a minute, the organizational structure of the division. If you have any questions, we can go through that because it's changed over the years. I don't know if I said it, I'm an academic pharmacist. So I would like to welcome everybody, and I'm glad we had a good turnout today. We've got a good group of people from all across the division, so I'm really pleased to see the representation here. Each year we get quite a few new faculty. We have a natural turnover, obviously. We have positions and programs that are growing. And we have obviously the natural transition that occurs within faculty. So I'm excited to see all of you here, and I'm excited to welcome you all to Idaho State. And and the important role that we all have in training health professionals for the state of Idaho and beyond. So let me go ahead and share my screen real quick. You guys can see that okay? I see a couple of nods. All right, well, we have quite a few things on our list to cover here, but they're really, it's not going to take too much time to go through some of this. But we wanted to talk about the organization and our culture and our mission. We also wanted to talk a little bit about our marketing and communication efforts, and Leanne Hancock, Leanne Waldron, sorry, she recently got married, is here as well. We'll also give you a little bit of a search update, particularly on the College of Health Dean search, to bring people up to speed there. Talk about some other issues, and then Chris Owens is here to talk a little bit about the faculty evaluation process, promotion and tenure, third year review, that kind of thing. And then we'll just talk about our faculty senators, our calendar of events, and hopefully have a bit of time for questions and answers. Again, if you have questions as I'm going through some of this information, please feel free to interrupt me and just ask away. So this diagram provides our organizational chart, and we recently, really just July 1st, reorganized and consolidated the College of Health, the Division of Health Sciences by eliminating a couple of colleges and dean's positions. Obviously, we've been dealing with budget impacts. We also are dealing with, I think, some political influences on that relate to some criticism of higher education in terms of administrative bloat and growth. And so we were asked by our president to look at ways that we could potentially consolidate the Division of Health Sciences. This time last year, we had really 3 open dean positions. We had a search ongoing for a dean in our College of Rehabilitation and Communication Sciences. We were working on a search for our College of Nursing, and we had a dean search in our College of Health Professions. And because we had those openings, it offered an opportunity to look at how we could consolidate our organizational structure. And this is what we came up with. This is what has been endorsed by the president and also been sent to our State Board of Education. We have a State Board of Education in Idaho that oversees and acts as the Board of Trustees for each of the 4-year institution. Well, each of the 4-year institutions in the state. So our organizational structure currently consists of 2 colleges. That is the Dean, the College of Pharmacy, headed by Dean Walter Fitzgerald, and the Dean position in the College of Health, which is currently vacant. We consolidated the College of Nursing into a School of Nursing, and also similarly, our College of Rehabilitation and Communication Sciences was consolidated into a school. And you heard from Karen Neal, who heads up our School of Nursing, and Chris Sanford, who heads up our School of Rehabilitation and Communication Sciences. These other programs listed below on this org chart were part of the old College of Health Professions. And that includes some of the programs you've heard about today. We have representatives from emergency services, counseling, community and public health. And then we have other programs within that academic unit that include dental hygiene, physician assistant studies, rad science, lab science, nutrition and dietetics. We also created during this reorganization a unit, a Department of Health and Wellness that includes our university health and wellness groups, and it includes our graduate training, graduate medical and dental training in family medicine, psychiatry, and dental sciences. We have a dental residency program and family medicine and psychiatry residency programs that are part of our training. And then we also have an Institute of Rural Health that is an interdisciplinary institute that promotes research and outreach to rural Idaho. I should also note that we have two associate vice presidents at present. Associate Vice President Patty Marincic oversees the Meridian campus, and you heard from Chris Owens, our Associate Vice President, who works on the Pocatello campus. Chris oversees the pre-health office and many of the activities that relate to curricular revision, curricular design, program growth, lots of different activities. And Patty Marincic is also very involved in the running of the Meridian facility and providing liaison activities to ICOM, the West Ada School District, and many other entities in the Treasure Valley. She and Chris and I also are serving as kind of a three-headed monster that is the interim dean or co-deans, if you will, of the College of Health. There are a couple of other units that I want to talk about here that really support the division in a very, very important and extensive way. And we have a group that acts as a liaison between our large academic unit and finance. And this includes Brian Hickenlooper, Joe Wilcox, and Kim I'm sorry, our senior accountant is actually an open position right now. And so we have a group that are very much engaged in the financial dealings, budgeting, and forecasting of the division. We have a group in our marketing and communications, including Leanne Waldron, who we just met. Ryan Giruff is our philanthropic liaison with the ISU Foundation and University Advancement in the division. Phil Yankovich does a similar role for the College of Pharmacy. And then we also have some clinic financial services. That includes Cindy Rock and Brian Hickenlooper, who I mentioned earlier. They work with making sure that our clinic operations are functioning properly. So let me just pause there and see if there are any questions from any of you just about the organizational structure of the division. Does anybody have any questions or comments? No? Okay. All right, well, let's talk a little bit about our mission, and this comes right out of our strategic plan. But our mission is to provide leadership in the delivery of rural healthcare by educating caring and competent professionals across all dimensions of health. And we also look to promote interprofessional research and practice in the health sciences. You should know that the KDHS, that's the Kasiska Division of Health Sciences, named after the Kasiska Foundation and the Kasiska family, which has donated millions and millions of dollars of scholarships to primarily health profession students over the last 30 years. The KDHS makes up about 40% of the university, if you include pre-professional students and all the students in our professional programs. So obviously we have a great impact on the university as a whole, and we are, I think, willing and collaborative partners across the university because so many of the general ed programs and courses feed into our professional and graduate programs within the division. One of the things that we like to emphasize and work on is increasing access and opportunity for students in Southern and Eastern Idaho and beyond. Obviously, we have online students in many of our programs. Those students are well served by our programs, but we want to have a substantial impact on the health of Idahoans through the training programs that we have. And really produce compassionate healthcare providers who are really engaged in their profession and engaged in the commitment they have to their patients and clients. One of the things that's been brought up already, I think Brian brought this up, is tremendous opportunities for interdisciplinary collaboration, both within the division and outside of the division, but still within the university and with community partners. So I think that one of the things that I'd like all of you to know is we promote, we encourage all kinds of interdisciplinary collaboration when it comes to teaching, as well as service and research, because we really are one ISU. And I think that a lot of times we get stuck in our own faculty position, in our own department, but the reality is there's a tremendous amount of expertise and enthusiasm all across the division and outside of the division that can really strengthen all of us in the research we do and the teaching that we do here on campus. I want to transition a little bit and talk about COVID. I'm not going to spend too much time on this because we hear about it all the time. I think people are sort of sick of dealing with COVID, but the reality is we have obviously a large response and commitment to having a safe campus. This website, isu.edu/roaringback, contains all kinds of information about the university's response to COVID and questions and answers, frequently asked questions and answers to all kinds of issues related to COVID. There's also a dashboard connected through this page that shows the cases that are present on campus, the trend lines that are occurring across campus. And also there is a link to what's called the self-report form, so that if you or students that you're interacting with might be positive, might be worried about being exposed to COVID, might have questions that they need to have answered, they can submit a self-report form or contact the COVID email address or phone lines to get their questions answered. We have a team of individuals that are spending virtually all of their time dealing with this COVID response. And we're happy to make sure that your questions are answered, those questions of your students, that you understand the policies, the changes in our operational status at the university. There's just all kinds of issues that come up there, and they're all linked through this isu.edu Roaring Back website. Any questions about that? Okay. Our marketing and communications department, this is Leanne Waldron's group again, is really looking to enhance marketing for our clinics, enhance media coverage in the Treasure Valley. And we've had some turnover in terms of other staff in our marketing and communications group in the Treasure Valley. So I would encourage those of you that are on the Meridian campus to reach out and become familiar with Leanne and her team for opportunities for promoting all of the good things that are going on. I know that Melanie Wright and Brian Austin, for example, have already met Leanne, worked with her to provide some promotional material related to their the grants that they've recently received. So thank you for doing that. But this can be anything: service opportunities, interesting programs that are developed, student highlights, highlighting relationships with our partners in the community. All kinds of ideas are out there to promote and co-promote the activities that we do across the state. We are doing more initiatives to engage with prospective students, including high school and college age students, to produce more digital media, video, that kind of thing, particularly with COVID, where in-person events are less likely, but also just because this is such an important way to reach out, promote ourselves, but also connect with potential students. And we're also, it's a good, this strategy of utilizing Marcom is a good way to increase awareness of your program while doing not only promotion, but talking about ways to recruit students or identify and enhance the knowledge of our given professions and our programs to a wider audience. So, for example, medical lab science spent some time with Leanne and did some interviews about COVID testing. And that was run by numerous different media outlets and highlighted not only important information about COVID testing, but also about our program. So we have an archive of these news events on our website, isu.edu/health sciences, and there's a news link there and a news archive, and you can check out all of our stories and what we've highlighted over time. We have numerous priorities for fall 2020. Really at the top of the list, and what we should be thinking about all the time are ways that we can support our students, recruit and retain students. And we have to do this you know, even in our programs where we have outstanding students that are very accomplished academically, it's still very, very important that we provide the right kind of support to those students. And I think it's even more critical when so much of our education is online at the present time that we reach out and engage those students, make sure that we're meeting their needs. We also are dealing with budget issues. Obviously, there was a significant economic downturn that occurred back in the spring associated with the COVID pandemic. The university had to make significant budget cuts, and so we are not immune from that. We've had to tighten our belt even further, and we'll be talking about fiscal responsibility as we move forward here at the university. I think that there is potentially good news that Idaho's economy has weathered the COVID storm fairly well up until now and will likely be ending the year with a budget surplus. We haven't seen what that means to higher education yet, however, and so it will be an interesting legislative session that kicks off in January that will address the budgets of higher ed and of our special other programs that we have within the division. We've talked a little bit about supporting our students, particularly with our transition to more online learning. One of the other things we're working on aggressively are articulation plans with our community colleges, making sure that we are accessible and that our coursework lines up fairly well with the coursework at our community college partners. We are implementing an Associate of Science in Health Sciences and new tracks in our BS in Health Sciences. That's a project that Chris Owens has been working on with Dana Gaudet on the Meridian campus. And I think it's exciting as we talk about, again, reaching out to prospective students and having the right kinds of pathways for our students to then be able to move through higher ed towards their career goals in one of our given professions. We are always looking for ways to grow our programs, and we anticipate that with that program growth and the other budgetary issues we've been dealing with, we'll be seeing new budget models for our programs, certainly addressing the revenue side of how resources are allocated at the university. We have a new, really a new almost entire team in the Office of Finance and Business Affairs. And those folks are busily working on new budget models that should incentivize program growth and the outstanding work that our programs are doing with their students. To provide you with a quick search update, the College of Health Dean search is moving right along. Phone interviews of qualified applicants will be done starting right away. They have narrowed that to a list of 7 applicants that are going to have phone interviews, and those should be complete here in the next month or so. The top candidates will be invited to campus in early 2021. So that search is moving along nicely and has representatives from many of the academic units within the College of Health, as well as some community representation from some of our partners. We also are searching right now for a director of our university health. This physician leader will be a very important part of the Division of Health Sciences, and we literally are to the point of being able to extend an offer here in the next day or two to one of those finalists. Any questions about any of those things? I'll pause here for just a moment. Okay. I think everybody's aware there's been a tremendous amount of national dialogue related to diversity, equity, inclusion, and justice. The Division of Health Sciences is standing up a committee to be able to look at these issues. This will be set up here in just the next few weeks. We, I think, have a lot of opportunity to work on this as it relates to our curricula, as it relates to our recruitment of faculty, as it relates to our recruitment of students. There are many issues related to diversity, equity, and inclusion and justice. And I want you all to know that I'm very supportive of these initiatives. I want this to move forward. I want our students to know and understand their role within the healthcare system and how it relates to these particular issues. And so this committee will have student representation, faculty and staff representation, and likely some community representation to help formulate some of the initiatives that will be rolling out moving forward in this area. It's time that we do this. We've talked about it for several years. Those that are new on campus, there was going to be a university-wide initiative and committee related to this. That has been paused, and it's been impacted, I think, somewhat by COVID and people not being able to get together in the same room and be able to talk about these things. At the divisional level, we decided we're moving forward with some of these initiatives and hoping to include this in all aspects of what we do within the division. So that's a quick update on where we are with some of these initiatives. The Idaho Center for Health Research is a subunit of faculty that are interested in fostering collaborative research within the division and even outside of the division. This group is made up of multiple different faculty members, and it's kind of led by this gang of individuals that include Patty Marincic, Renee Robinson, Elaine Wynn, Barb Gordon, and Mary Van Mulken. You met Irene Van Worden just a moment ago. She's a part of this team and helps to support biostatistics within the division, and is actually the biostatistics liaison with what's called the Mountain West Clinical Translational Research Infrastructure Network. That's this MWCTRIN. This is a consortium of institutions in the Western US. It's funded by the NIH and offers faculty development, research support, pilot grants each year. And we're a founding member of this group, and you will see announcements come out about educational offerings as well as funding opportunities from the MWCTRIN, and this can really jumpstart some of your early research projects. So I would encourage you to become engaged with the Idaho Center for Health Research as a faculty support and an interdisciplinary gathering of folks to be able to be involved in research, but also to keep an eye out for emails from the MWCTRIN. They have some meetings scheduled every month. The next one is going to be Thursday, the 12th of November at 1 p.m. and is going to be an interactive brainstorming session to talk about project ideas and collaboration. So if you're interested, you can go to their website. Again, it's sort of a subpage within the Division of Health Sciences. You can join the ICHR with just a couple of clicks, and you will then be signed up for emails and information about the activities of this group. At this point, I'm going to turn it over to Chris Owens for a few minutes to talk about faculty evaluation process, third-year reviews, promotion, and tenure. Chris, I'm going to stop sharing and hopefully you can share, okay?
All right. And go. You should be able to see that slide. Evals, reviews, P&T. All right. Well, all right. Hello again, everybody. I'll just take a few minutes. There are 15 slides in this slide deck within the slide deck, but I will go through it relatively quickly. I'll just make a couple of comments. This is part of a larger presentation. Every spring there is well, at least for the last few years, I've been a part of a promotion and tenure workshop that is put on by Academic Affairs. And so I will make these slides available to you now. We can go ahead and get them sent out, but there's also a larger and more comprehensive set of slides, and actually a really helpful discussion that we try to hold every spring as we bring together a panel of people who have gone through the promotion and tenure process. Department chairs and program directors are there as well, just to kind of talk people through, especially faculty who are in the earlier part of their career at the institution, as to what the expectations are here at Idaho State. But let me just kind of move through these slides by first just talking about the annual evaluation process, which is just how people are evaluated as faculty and as staff on an annual basis. Obviously, it relates to further on review processes. It relates to the promotion and tenure process as well. But every year, all faculty and staff receive an annual evaluation from their supervisors, their program director or department chair, as well as from the college dean. And so as a part of that process, each faculty member updates their profile in Activity Insight, which is a program that we use within the Bengal web page that I'll show you in just a second. But we use Activity Insight as a way to track your teaching, your service, your clinical and your scholarship activities. It's a way that it's kind of a virtual CV and resume also. It's populated with data from institutional research related to teaching as well, in terms of credit hours and classes that you are the instructor or coordinator for. But that Activity Insight is a key part of this process. To go into it at this point would be far too much, but you can talk to your department chair or your program director, or you can contact me and I can kind of walk you through that Activity Insight process as well. But relatively recently, we've coupled that with now yet another program, the Talent Management System. So don't confuse Activity Insight with Talent Management, although they are both related to this process of annual evaluation. The Talent Management System, also within Bengal Web, is a place where you go on a yearly basis to take the information Activity Insight that you have downloaded and created a PDF for and upload it into Talent Management, answer some questions, and your department chair also fills in some information there as well. I promise it sounds very abstract right now, but as soon as you see how that kind of process works and goes step by step, it will be more clear. But this is how the annual evaluation process works, where each faculty member is evaluated in this way every year. And we all follow the general ISU process, although your department and your college may have additional requirements and things for you to do. But let me just show you on Bengal Web. If you were to go into Bengal Web and go to University Resources, you would see this Activity Insight site where you would click into there, and that's where you would populate your activities within Activity Insight. Also within Bengal Web, you have within the Employee tab, the Talent Management System, which allows you to access talent management. That also is where you go for annual evaluations. And also, don't worry, there are emails that come out that walk you through this process as well, in terms of how to access this and what other resources and tools there are to help. But I guess how it really relates to you at this point is, one, knowing that this process exists, that it has the two parts, Activity Insight and management, and the fact that just the way annual evaluations run on campus is that they run on calendar years. So we will evaluate you now this year in the next couple of months for your first year evaluation. And that's even if you only started in July or August. Your first year evaluation will take place towards the end of the calendar year or the beginning of the next calendar year for the previous year. So right now we're coming up on evaluation time for the year 2020. And so you will still do a first year evaluation, even if you've not been here for a full year yet. That's typically what that first year's evaluation looks like anyway, for most people. And so the deadlines for getting stuff done with activity insight and talent management are set by academic affairs. They differ somewhat, or have historically at least differed in terms of whether you're a first year or a second year or a third or fourth year faculty. But typically, again, this is the time of year when working with your department chair, you should figure out when those deadlines are for getting that information uploaded into activity insight and talent management. So that's the annual evaluation process. Any questions about that before I move to the third year review process? All right, excellent. Third year review. This is a mandatory process for tenure track faculty, but it is mandatory for non-tenure track faculty. This is simply a mini promotion and tenure review, if you will, that is done in the third year of your appointment if you are, again, are in a tenure track position. It doesn't involve external reviewers, but it does involve a more in-depth review than an annual evaluation would from your department or program's faculty, for example, and some comments from the department chair. So basically what will happen in your third year is that you will do not only the annual evaluation, but kind of we add to it this more in-depth third year review, which will then take into account how on track you are towards a successful bid to tenure and promotion. Or if you are a non-tenure track faculty member and your program does choose to do a third year review on a non-tenure track faculty member, then you will have the option at that point to have this more in-depth third year review at that point in time. For information on the promotion and tenure process itself here at the university, I would refer you to the ISU Policies and Procedures 4020, which is on the Academic Affairs webpage, which basically lays out what the general expectations and parameters are for promotion and or tenure at this institution. And I'll show you in just a slide or two that the Kasiska Division of Health Sciences likewise has a promotion and tenure policy, and your college will also have a promotion and tenure policy. And ideally, these are all congruent with each other, and they flow together, they work together, so that completing the requirements of one takes care of the requirements of all. Of course, that's always a work in progress to make sure that's as streamlined as possible. So I'll go quickly through this. There are at least two main types of faculty: tenure track and non-tenure track faculty, but even within those faculty, there are individuals that are of a subcategory even of these. And what's important to note is that all faculty have responsibilities in teaching, scholarship, and in service. And whereas one aspect of this part of your position may be emphasized more or less than another, a more teaching heavy faculty, a more research intensive faculty. But all three of these are in general an expectation of all faculty. Again, though, they may be emphasized differently. Tenure, I've just got the definition of tenure here, which again, we go into great detail at tenure and promotion workshop, but tenure is basically the right to receive an annual renewal of one's contract, as opposed to non-tenure track faculty who are renewed on a year-by-year basis. To be eligible for tenure is to have completed 4 years of academic employment at the institution. And it's also important to keep in mind what these timelines are so that you are, again, on the right trajectory. By the third year review, you have a good idea of where you stand. And then by the time you've completed your 4th year, then you would be eligible for for consideration of tenure, for example, not later than the 6th full year of academic appointment. And that's all spelled out in the guidelines. Now, when this clock starts is very important, and some of this may actually be in your offer letter if you're in a tenure track position as to what from your previous institution counts towards your tenure timeline and what that timeline looks like. It is often, sometimes in that offer letter. If not, it's definitely something that you can talk about with your department chair during your first year's evaluation. And that's why really utilize that first year evaluation to the full by having a good discussion with your department chair in terms of what these expectations are. So the example I gave here then is if you joined Idaho State University on July 1st of this year as a tenure track faculty member, when then would you be considered eligible for promotion to associate professor, all other things being equal? Basically, what it would be is after the completion of your 4th full year of appointment here at the university. Again, unless other arrangements were made in terms of the way the position was offered to you. There are some additional criteria that you will see in addition to what we see in the ISU general policy related to promotion and tenure. KDHS and some colleges have additional criteria, including collegiality, engagement in the department, professional and clinical kinds of activities. Those all you'll need to look at your specific programs or college's policy. This has come up actually more this year than we've seen it before. We just talked about start the clock, but there's also stop the clock. There may be extenuating circumstances which might prohibit a tenure track faculty member from being on target to maybe they need a little bit longer to get to where they need to be because of something like COVID-19 really throwing a wrench in the whole year, where people maybe want to stop the clock during a pretty significant circumstance like that. That's something that can be discussed with your department chair and your dean, and then with approval of academic affairs at the university level, the clock can be stopped for a certain period of time, as long as that's very clear as to when it stopped, why it stopped, and when it will restart. And that's also in the policy. And then I've included a couple of links here to the policies that you can find at the university level and for the Kasiska Division of Health Sciences. And then I'll just wrap it up with this kind of generic tips for success as a new faculty member. It's really important to one, be aware of what the expectations are in terms of the annual evaluation, the 3rd year review, what it is, what it means, if and when it applies to you, the promotion and tenure process as well. Throughout any of these steps though, documentation on your part is of course vital. Being aware of your clinical activities, your scholarship, your service-related activities, teaching as well. Now, teaching is captured within other systems within the university. So we know what classes that you are in charge of in teaching and coordinating. The university can populate that side. But in terms of your other activities, it really is incumbent upon you to document and to document thoroughly all of these different areas of your activities and all the different areas of your position. Because success really requires that you manage your time and pay attention to the different areas that you are responsible for. And again, I can't stress enough the importance of really utilizing that annual evaluation process to have frank and open conversations with your department chair about your expectations, about how well you're progressing, keeping in mind as well that you can receive a rating of meets expectations every year for your annual evaluation and still not necessarily be on target for a successful bid at promotion and or tenure. So there is that which is not a total disconnect, but the conditions for tenure and promotion are more typically than just meeting expectations every year. There's some going above and beyond that obviously needs to be a part of that process as well. But I'll stop there. I've probably gone on way longer than what I should have. But again, there's more that will come on. There's that promotion and tenure workshop as well. But I'll pause for a second and take questions. I thought I saw a chat come in. Let me look at that. And I'll stop talking for a minute.
The chat was me. I looked at Activity Insight and have started pulling some things in, and I was just wishful thinking that it would talk to Cayuse and not just like PubMed and the teaching. And I know that's probably wishful thinking, but I just want to throw it out there.
Yeah, I mean, they update and they've tried to improve, and they've actually have made, I mean, in Activity Insights defense, they actually have improved it over the years, if you can imagine, right? So it actually has gotten better, but it still isn't as smart as we would like it to be in pulling in data. A lot of up to you to put in and to put in with the right dates, et cetera, to make sure that it's in there accurately. And I can't underscore that enough too. The information you put in Activity Insight is part of our institutional research. That is the information that the university uses, so make it as accurate as possible.
Thanks, Chris. And we're happy to share those slides. I put that in the chat box. Any of these slides, just let us know if you'd like a copy. There's some very useful information and some good links in there. I'm gonna just wrap up with a couple final slides. Your KDHS faculty senators are listed here. They frequently will send out email communications about the goings on of the faculty senate. That communication, I think, has been much better the last year or two from faculty senate, and we have great representation from these senators. They're very committed, spend a lot of time on their faculty senate service obligations, but you are absolutely welcome to engage with them, take issues to them if you have questions or concerns about the operations of the university. We also have a calendar. This calendar is linked from our isu.edu/health sciences webpage. You can subscribe to this Google Calendar. If you have events to add to the calendar, you can email them to the address here at the top of the page. And if you subscribe to this calendar, obviously it will show you all of the different activities and goings-ons. It also has important dates throughout the semester. So the timing of evaluations, the timing of due dates for tenure and promotion and things like that. Chris talked about that. We have a set academic calendar, and those dates are usually included on this shared Google Calendar as well. So it's 1 o'clock on my clock. I wished we would have had more time for questions, but I certainly can hang on for a little bit and try to answer any questions that you have. We also are going to be asking you about some feedback. Obviously, we took some time getting to know the group at the beginning, and I think that was worth it. But it ate into some of our time here in terms of getting through the slides and the discussion. Again, I want to welcome all of you. We're excited to have you on board. We wish we could have had an in-person meeting and shared a noontime meal or something with all of you, but we're doing things with Zoom these days. Any questions that anybody has? Okay, well, like I said, we will be reaching out to you with some feedback, things that you'd like to hear or like to have included. We'd like to hear from you, and I hope you all have a great rest of the semester. Again, welcome to ISU, welcome to the Division of Health Sciences, and have a great rest of the day. Thanks, everybody.
Everybody.
We'll see you.
Thank you. Good to meet everyone.